Welcome back. Well, before we get September kind of out of the way, there's a couple days left, and there's something really important we need to talk about this morning, and that is that it's Obesity Awareness Month. And joining us this morning is Dr. Raquel Hernandez, the medical director of the Healthy Weight Initiative, which is a great program. We're going to hear a little bit more over at Johns Hopkins All Children's Hospital. And as a mom myself, kind of watching the kiddos, making sure they're getting enough exercise and nutrition, it's a big job. I feel like that's a job all in and of itself. So good to see you. Good morning, doctor.
Good morning, Carly. Great to see you too. And I completely understand what you're saying.
Yes. And we were talking before we got started that I think this year, 2020, our schedules were all interrupted. I think our attentions were called to different things this year. And I think it's a great reminder this month to really look at the nutrition and the exercise and things that we're making sure that the kiddos are doing, right?
Absolutely. Absolutely. I think, as you said, even prior to the pandemic, we know that childhood obesity is one of today's major health issues that are affecting children and families, to the point that 1 in 3 kids currently is either overweight or obese. So, post the pandemic, as you said, everything that was helping us in terms of, exercise, getting kids outdoors and in activities, as well as having good quality food around, all of that has been thrown for a loop. And so, as you said, all moms, all families are being challenged right now. So being aware of the problem is really, really important.
All right. So there it is. We know that it's an issue. Talk about some of just to really drive home the point of, if your child is obese, what does that then lead to? I mean, why do we need to be so concerned about this? Because some parents may go, well, they're in a growing phase. That's kind of, you watch your kids kind of plump up, thin out, plump up, thin out. I mean, I know I do with mine.
Absolutely. And, it's interesting. There are several, what I would call misperceptions or myths about childhood obesity. One of them is that, that expectation that kids will outgrow their weight status. And really, the only person who can really sort of guide you around that is your pediatrician, in terms of looking at where your child's trends are going. But unfortunately, we know that fewer and fewer kids do outgrow their weight, just because our food environment is so tough, where, it's so much easier to grab a candy bar than it is to grab fresh fruit in today's environment. So that likelihood of your child outgrowing their weight is really kind of low. And so I think the earlier that you can talk to your pediatrician and understand what might be the barriers, the better, because we know that those kids who stay overweight or obese unfortunately end up being unhealthy and developing issues like diabetes, heart disease as they grow older.
Well, and that to me sounds like it's all about healthy habits. And I think as adults, I wish we, maybe would have started younger with ourselves, right? So what are some things that parents and families can keep in mind if they kind of need to redirect their kids and children on a healthier path? What are some things that can help, do you think?
Absolutely. So we talk about something in our clinic called the healthy house. And we tell families that you can't have a healthy house unless you've got 4 strong pillars. And those pillars are diet, so healthy diet, obviously, activity, which we know about 60 minutes of activity is what most kids should be trying to achieve on a day-to-day basis. And then those 2 other pillars end up surprising some families. So the third pillar is actually sleep. So we know that most children require at least 9 hours of good sleep to have what's called sort of that healthy metabolism. And then finally, the 4th pillar is something called behavioral health or mental health. And Carly, as you know, I think that's becoming a greater challenge for all of us during this time. And so we actually end up talking a lot about that with families in terms of that healthy house. So it's important to keep that model in mind.
What's so interesting is, I know we're talking about kids, but I feel like these are good rules of thumb for adults too. And I know we can make such a big difference if we're setting a good example for our kids too.
You hit the nail on the head. And I think, what I love in terms of talking with families is that they tell me exactly what you just said, which is, wow, I really need to show a role model, what I want my kids to do, where, all of us are affected by the fact that, like, yes, we're on our phones. We don't sleep enough as busy adults, but it's incredible when families start to do things together and really prioritize it. The impact is huge. It really is.
Yeah. All right. Where can people go for help? Because again, this is a big job to kind of tackle on your own. And it's been an overwhelming year, I think, for everybody anyways. But there are great resources. So where can parents and families go, do you think?
Absolutely. So they can visit our website. Allkids.org is our institution. And in that webpage, you can Google the Healthy Weight Initiative. And there we've got some descriptions and some resources of programs available. And absolutely, we'd love to hear from any family who is interested in coming to our clinic. We have something called the Healthy Steps Clinic, where we talk about healthy lifestyles with kids and families.
Yeah. Well, again, I try to do it in our house. Make sure you're keeping in check with your pediatrician, as you said, track those trends. Thank you so much. I'm so glad. Again, September may be ending soon, but this is an important message to get out.
Thanks so much, Carly. Great talking with you.
All right, you too. We'll make sure and put all this info on our website too.